People tend to think of surgery as a luxury, but it is a cornerstone of global public health. Around 3 million people a year die of HIV, TB, and malaria combined. And about 10 million people a year die from cancer. The people that are dying from lack of access to surgery dwarf those numbers. We have a responsibility to train enough people to be able to treat those people that are dying today. As a foundation, we're thinking about building a fundamental educational infrastructure that will allow there to be enough high-quality surgeons out there to meet these global needs. The mission of the Intuitive Foundation is to help reduce the global burden of disease and to improve outcomes for patients everywhere. We really believe that the main ways to do this that we will be most effective is through philanthropy, and education, especially research into educational methods, is one of the highest leverage ways that we can think of to make a lasting effect around the world. When we think about the way we traditionally teach surgery, we confine learning to medical schools and the environment around teaching hospitals, and we don't have as much of a mechanism for continuing education anywhere in the world. What we do is fund research programs in clinical research, as well as doing outward-facing programs like training surgeons in low and middle-income countries or training biomedical engineers to maintain surgical equipment.
We also look for other opportunities that really try to gear more of the underserved into areas where you often don't see them in medicine. So, for example, surgery is a discipline for which you unfortunately don't see a lot of minorities.
Our outreach initiative is one of the programs that we have to address the problem of the leaky pipeline of women and minorities in STEM and healthcare. What we mean by the leaky pipeline is it's possible to inspire all kinds of young students to go into STEM fields or healthcare fields, but along the way there are a lot of things that systematically will knock them off of that path.
Unfortunately, you see a lack of interest in STEM and healthcare, which really comes from a lack of exposure. And so how the foundation is really trying to address this leaky pipeline is by reaching the underserved community and kids as early as possible to really expose them to STEM and healthcare and all the great possibilities that are available to them.
Hey, how you guys doing?
I'm a strong believer in that the power of education can break that cycle of poverty.
Hey, good morning, X.
Our program provides STEM enrichment for underserved students in grades 6 through 12 here in Central North Carolina. Saturn Academy is an opportunity for students to come to a major college campus and to gain exposure in areas of STEM that they probably would not have at their regular high schools. Our middle school students, most of them engage into a robotics coding class. Our high school students are taking a college planning class.
One of the things that I think that this program does really well is very holistically looks at how do we really help elevate kids and how do we help refine the attributes that they have so that when they get to high school, they're really thinking about college. They're really thinking about next steps.
How can you get this one to turn on? That's your challenge.
We want our students to be in a position where they're comfortable enough to be able to express themselves well, to be able to engage with anyone, and hopefully get that full scholarship to college, which, is just life-changing for a lot of families.
Hey.
I think that this mission around getting more underserved communities and people engaged and involved with STEM and healthcare is only going to make our world better. And when you look at what Catherine and all of the volunteers really want this to be over the next 5, 10, 20 years, it is absolutely limitless.
The the goal that we are working towards is a blooming ecosystem where anyone can come in and learn how to do the procedures that are necessary to save or improve the lives of the people in the community that they live in. People think about these lack of access to surgeons as demographic problems, as people problems, but they're people solutions. You have to train people, you have to give people access to that education in order to allow them to care for one another. So we see making lasting changes in the environments that we are intending to affect is really at its core education. And that's the revolution we wanted to create.